Good afternoon, everyone, and welcome to the Henry Schein Dental Academy webinar series. My name is Adam, Marketing Specialist, and I will be your moderator. We're excited to welcome three members of the ProEdge Dental team, Kelly, Kelley, and Mike, as they discuss all things Waterlines, including what it takes to be CDC-Compliant and how to protect your practice. Before we get started, a few reminders for everyone. During the webinar, please feel free to submit questions via the Q&A section of your control panel. Questions are certainly encouraged, and we will answer them live at the end of the presentation. Henry Schein is not offering CE credit for viewing or attending this presentation live or on demand, and this webinar is sponsored by ProEdge Dental Water Labs. ProEdge team, thanks for joining us and speaking on this super important topic.
Adam, thank you so much for having us. We're really excited to be here. Thanks for everybody for joining this evening. We've got a lot to talk about. There's a lot going on in Waterlines, and we want to make sure that both your practice and patients are protected, you're compliant, you know exactly why this is important and how to mitigate it and be successful in your practice. So thank you so much. Before we get started, Adam's going to launch a quick poll. We'll kind of go through some introductions here, but while you're listening to that, tell us when was the last time you tested your water lines. While you're answering that, I'm going to introduce two of my favorite people. Kellie Thimmes, also known as Kellie T, because I'm the guy on the right of this deck. I'm Kellie B, and that can be a challenge to get straight after a while. So Kellie T is ProEdge's senior consultant and education specialist. She spends hours and hours and hours every single week talking to you all. She works with hundreds of practices a week to help them understand their practice, their water lines, their protocol, tips and tricks, whatever it takes to be successful in waterline maintenance. And so she has tons of experience with all sorts of unique circumstances, and she's got all the knowledge to share with us today. And we got Mike Rust. He is probably the most experienced human being in waterline maintenance on planet Earth.
Right, he is.
I'm just the oldest guy. Just the oldest guy here. We have a special guest. We have a bunch of special guests in the audience, including John Molinari. So don't be bragging. How about, isn't that kind of cool? And some great friends from Schein and some great VIPs from the West Coast. And,
well, thank you all for joining us. Mike is being modest. Molinari certainly knows a lot more about bacteria and infection control in general. But Mike has stuck his hands in a lot of dental units, in a lot of dental unit water lines. That I'm sure Kevin Molinari
I've made every mistake you can make.
That's true. That is true. So really excited for Mike. He's going to share a lot of his experience and knowledge with us. I'm Kellie B, again, VP of Marketing and Sales with ProEdge. I've been with the team for 3 years. Love these two. Love this team. Love what we get to do every day. So we're really glad and appreciative to be here. We've got some objectives today. Kellie T, what are we trying to achieve with this webinar?
Yes, thank you. And thank you for that introduction. And welcome, everyone. Thank you for joining us this evening. Basically, we want to set you up for success is what we want to do tonight. Learn the basics of how to effectively and efficiently set up a waterline maintenance protocol for your office and know why it's important to do so. The main thing though, guys, and throughout this whole pandemic, we know that it's been extremely hard for dentistry. So we wanted to let you know, and even beyond the pandemic, prior to the pandemic, we thank you, we see you, we appreciate everything that you do for us. Saw this picture on LinkedIn a few months back, and it took my breath away. It's mind blowing. All the extra, I guess, PPE that you all have to wear every single day. It's hard for me to wear a mask inside a store. I feel like I've run a marathon just walking in the supermarket. So thank you. I know this is, hopefully we'll be getting out of this soon, but we really appreciate you. We sit in your seats every 6 months. And so we thank you from all of ProEdge.
Yeah, as patients ourselves, right? We sit in those dental units, so we really appreciate all you do to be safe for all of us patients. A couple of things. we've already had one question in the Q&A, but this is a Zoom webinar. So in your menu settings, there's a Q&A function. There's a Q&A button. You can ask whatever questions you have. We'll be monitoring that through the webinar, and you're probably going to jump in there with a question that we'll probably answer later on, but we'll also have some time at the very end to go over those things. So please ask away. We love those questions. A recording of the webinar will be available through Henry Schein on their YouTube channel, and then also their webinar page. Maybe, Adam, don't mean to put you on the spot, but maybe you can share that link in the chat as well at some point. But with the Q&A function, right, we're going to talk about a lot today. We're only going to have 10, 15 minutes of Q&A. Keep reaching out. If you've got questions that weren't answered, or you've got things that are particular to your office, or something about what we talk about confuses you, please reach out to the team at ProEdge. Leverage our expertise and resources. We'll go over consultations at the very end to show you how we can do that for you, all complimentary, and we're here for you. Also, today, because you are registered for this webinar, Henry Schein has put together some exclusive promotions with ProEdge products. So we're really excited to partner with them on that, and you'll have access as we go. But Kelly, let's make sure we're all on the same plane. We're all starting on the same, on the same page with Waterlines. What Waterlines are we talking about?
Yeah, absolutely. And, getting to talk to customers all day, every day, all week, it gets a little bit confusing because there's a whole bunch of Waterlines, and there's shock products for Waterlines and shock products for evacuation lines. And so it can be a little bit confusing. And so we're going to be talking about these lines throughout this whole webinar, but we want to make sure that we are clear on which lines we're talking about. And we are talking about the water that put the lines that put water into your patient's mouth. I'm Italian. See, I'm already using so much hand. It's fine. Water syringe line, handpiece, Cavitron, scalar lines. We are not talking about your evacuation lines. So that's not our area of expertise. Also, you're going to hear us say these three things a lot. In fact, you may want to keep count of how many times we say the word shock or shocking. I think a couple of webinars back somebody did, and I think we said it like 198 times, which is insane. But want to just
We'll try not to say it that many times.
Exactly. But just kind of keeping it high level so you know what we're talking about throughout. So shocking. What is shocking? Shocking is using a strong chemical to clean out the insides of your water lines. And then treating is using that low-level antimicrobial, like a tablet or straw, to maintain the lines that you get clean with shocking. And then testing, and that's going to be your proof. That's going to verify that the shocking and the treating worked. And it's going to prove that you meet CDC compliance.
All right, so let's dig in. We're going to start with the why. Why, Kellie T, is it so important that we talk about safe water lines and maintaining them?
I love starting with the why, Kelly, and I think it's most important to start with the why. I think that's why you, Mike, and I are on this tonight. Why we work with ProEdge and work for ProEdge, and why we do what we do. We want to spread the word of why waterline maintenance is so important. Why does our team care so much about spreading that information, right? The why is why I care so much about what I do every day, and why I want to talk to as many people as I can to help them establish that safe water protocol for their office. And so, before we move forward, just think about this throughout the webinar, and ask yourself this question: is your water safe? And if you can confidently say yes with 100% certainty, awesome. But if not, just hang on, because we're gonna teach you how. And the reason why it's so important is because of people, of little girls like this, like Mimi Morales. And she's just one of the sweet little faces behind why dental unit waterline maintenance is so important. She went in for a routine pulpotomy. And guys, I have an 8-year-old, and I can imagine taking him into the dentist, routine pulpotomy, routine visit. Next thing you know, a month later, she starts getting this horrible infection in her mouth. She gets this redness, a big abscess. Her parents take her into the hospital. the infectious disease specialist, and I'm paraphrasing here, but she said something to the effect of she had never seen such a horrible infection in all of an oral infection in all of her career. And she's an infectious disease specialist. So it was that bad. Mimi had to have surgery on her jaw. She had to have several permanent teeth removed. She spent more than a month in the hospital and received tons of heavy duty antibiotics. I'm sure a broad spectrum, but finally what worked was the antibiotic that was created to treat leprosy, which she had to be on intravenously for 7 months. So, which she developed side effects from that too. So, I mean, again, guys, I got an 8-year-old. I can just imagine not only having permanent teeth removed, but then also side effects from the cure. So, put yourself in that position of being that parent, that aunt, that uncle, that friend. And it's not just one, it happened to many. Mike, can you tell us a little bit more about the timeline?
Yeah, I'll just tell you about the numbers. It would be, Kelly, that would be it'd be a great movie if it wasn't a tragic true story, right? It'd be like an episode of CSI. Kid shows up at the ER, and here's the scariest number to me, this 85. 85 is the average number of days it took before any of these symptoms manifest themselves. This new thing called Mycobacterium abscessus, it's new to us, but it grows in dental unit waterlines, and it takes up to a year before the symptoms manifest themselves. So this is why it's hard to prove causation, because it can take a while. You take your kid to the ER and they say, did you go to the dentist? You're going to say, we haven't been to the dentist in a year or 3 months or 5 months or 8 months. And that's what happened. But you're right. Another miracle is that the doctors on call at Children's Hospital, Orange County, put it together. There more and more kids showed up. More and more kids showed up. 99% of them were hospitalized. We happen to know that there's over 200 lawsuits filed. So there's about 200 families impacted. It's going to be in the news when they're going to have 4 bellwether trials that could go to court this year. There were 12. It's going to be a black eye for dentistry, and it's going to be a black eye for corporate dentistry, because there was 12 locations. It was a DSO. They sold 11 of them to pay for this multi-$100-million lawsuit that's coming down the pike. It's going to be a black eye and going to be in the news, and your patients may start asking questions.
And the thing is, exactly, Mike. And it's a tragic story. And like you said, if it weren't for the miracles that kind of happened to link it together, right? It was a true miracle that they linked it back. Not that we want any practice to be shut down, but that they were able to help the kids who got sick. And the sad thing is, it's not the first infection. There was one that happened in Atlanta beforehand. We get calls every, couple of months from a doctor's office or a dental office, and even from dental professionals themselves that have Mycobacterium abscessus in their lungs, and they tested their water lines and they found it in there. And so just the aerosols. And so I wish I could say that Anaheim was the last, but unfortunately we do still get calls. And so this number here is the most important one, because the thing about it is it's 100% preventable. And so we want to teach you ways to do that. So we don't want to tell you that story to scare you or to, cause fear, but we want to teach you ways that you can prevent this from ever happening to you.
It is important. And so we're going to talk about, that's the why. We're going to talk about the kind of the how, why, or how biofilm develops, and, the uniqueness of dental unit water lines and how they kind of created the perfect environment for this growth. But then we will get to the practical application of how do you make sure that this is prevented in your office. So Kellie T, let's get a little bit nerdy. We're going to stay high level. We're not going to get too nerdy, not as nerdy as sometimes we get in this lab. But let's get a little bit nerdy so people understand.
We are nerds. We are complete nerds. Yeah, we test everything here. So we talked about why it's important, but why does it grow so well in dental unit water lines, right? Why does biofilm grow so well? And it's because number one, they're super, super small lines, but the water in them sits stagnant most of the time. So they're less like this, like a flowing river, and more like this, like a stagnant, dirty pond. And no one wants to think that we're squirting pond water into our patients' mouths, right? But the fact of the matter is, and Mike, I think you say it best, the water sits stagnant, 23 and a half hours out of the day, right? Because they're in your air.
Even in the busiest hygiene room in the world, it's over 99% of the time, the water's sitting stagnant in a tiny little 1 millimeter water line. It's a really good Petri dish.
Right. Yeah. And so, it's the perfect place for biofilm development. And biofilm creates a perfect place for pathogenic bacteria to grow. And it's stubborn, right, Mike? Super stubborn.
Yeah, we're nerds, but the guys at the Biofilm Institute are real nerds. And we kind of stole this slide idea from them. But they say that biofilm is sophisticated. You don't think of pond scum and soap scum as sophisticated, but it is. One of the ways disinfectants work is to disrupt the communication between all these different cells who have different jobs. Some of their jobs are to attach, then their job is to grow, and then some of their jobs are to detach. What we like to say, and this is a good takeaway, I think, is that biofilm's job is what? To go forth and multiply, right, Kelly?
Exactly. Yeah. And we're nerds for just knowing all about the complexity of biofilm, but it's true. Yes, go forth and multiply. That's exactly what we say. But I like to, and this, of course, they quote me on this because they make fun of me for using this analogy. But it makes sense to me. So biofilm, how it kind of goes downstream or down the tube is like a dandelion. And I always say this, and through COVID, we had a lot of webinars, but walking outside, saw a ton of dandelions popping all over. And actually that was true. I did take my dog out earlier and there are dandelions everywhere. But what happens when you blow on a dandelion? The seeds kind of disperse, and next thing you know, you got dandelions growing all over the place. And I know Kelley B, for one, doesn't want those in his lawn. I know that he's super.
I love my lawn. I don't have Waterlines, exactly. And I have to use some strong chemicals sometimes to get rid of those things.
Hey, see,
it's a pretty good analogy.
Yeah, so the same thing happens with the biofilm in the water line. So every time you use your air water syringe, a little bit of biofilm or bacteria can just kind of break off or slough off. Break off in chunks. I hate saying that word, but it can, and just breaks off, goes downstream. When you stop using your line, it reattaches and the whole thing starts all over again. And it happens very, very quickly.
And sometimes it gets this bad.
Yes. And this is at its worst. And these are recent pictures, and a couple of those, the samples in the middle are samples that we got into our lab. And, this is going to be the worst case, right? If you see this, you're going to be like, I have a problem. I need to do something about this. And in fact, these were probably taken by technicians. I think some of them were because
they're unusual, right?
It got this bad, right? The lines wouldn't flow anymore. Well, we can see why, right? But that's how this is the worst of the worst. But I want you to know, and this is even the craziest part, is most of the time, the samples that we get into our lab, this one in particular, it looked clear as the flowing river that we showed earlier. But when we tested it, it was it had over 90,000 colony forming units of bacteria. So basically too numerous to count. And it looked perfectly clear. So a lot of the times it's microscopic. You're not going to see it. I mean, clearly if you saw the pictures before, you're going to seek out help. But if you see this, you may not know you have a problem. And so that's why we do what we do. And we want this message to get spread as much as possible.
And it speaks to that, again, that cycle with again, like Mike talked about, the intelligence of that biofilm. They're all talking to each other. They send signals to each other. They have ways of creating channels to grab food and reinforcements. And they're really complex, intelligent things, and they can replicate very quickly. A lot of times people will say, well, I have brand new dental units, or I have brand new dental unit water lines, so I don't really need to worry about this, right? Because, Joe Blow down the street, I know he's got units that are 15 years old or 25 years old. he might have a problem or she might have a problem, but probably not me. Well, this is, what we call the Barbeau study. And this published study that showed that bacteria reached 200,000 CFUs. That's 400 times the CDC standard in less than 5 days using sterile water and brand new water lines. So again, biofilm is very good at what it does. It's been here a long time. It'll be here a long time still to come, but not in your water lines if we keep paying attention. So we're going to talk about kind of, okay, what do we do now? How do we take care of this? And that really goes to the CDC. They have, since 2003, had the same recommendations to dental practices of how to mitigate this challenge. And a lot of people will say, well, they're recommendations, but they're a little bit more than recommendations in a lot of states. So if you look at this map, these are all the light blue are the state dental boards that require CDC compliance. And we'll go into exactly what the CDC says on dental unit water and water lines in general. But if your state is highlighted in blue, that dental board says, hey, if you're not following the CDC guidelines, your license is on the line. There's a couple that are a little bit more general with it. And then there's some that have non-specific regulations. Kellie T, I know, we just talked about 2 of those states.
Exactly. Yeah. If you'll notice, California and Georgia, they're in non-specific. It's not specified. But like Mike was just talking about, it's going to be a black eye for dentistry here soon, the largest lawsuit in dental history. So CDC, they may just be recommendations or it may be non-specific, but it's really important that you look for that you look at the IFUs, the instructions for use for the products that you're using, as well as for the manufacturer of the dental equipment that you have, and treat, because you want your patients to be safe. You want to go above and beyond what the CDC says and just be safe for you, for your practice, for your patients, for your coworkers.
So light blue, that's all required. And then Washington State, I didn't see anybody in the chat that was from Washington State, but if we have any Washington State dental professionals, they have new regulations that go live December 1st of this year, requiring quarterly waterline testing. And we'll go into a little bit more about that. But all those light blue states, in your state, it is required to do the following. Now, we try and make this simple, the CDC guidelines. I wouldn't say most of you will enjoy the read, but we dive into it a lot. And so we've broken it up into 3 pillars to try and make it as simple as possible for you. The first one is surgeries. When you are doing surgical procedures, what do practices need to do, Kellie?
And this is critical. If you're doing any kind of surgical procedure, and the CDC lays out what a surgical procedure is, they have a clear definition of that. If you need the wording on it, please let us know. But you can easily find it. But it's basically, and Mike always likes to say, if what did you say yesterday, Mike? If
there's a scalpel or a suture involved in sterile water from a sterile source.
There you go. Yeah.
I'm not, there's better experts than me on this one, so let me right.
There's clear wording, but I liked Mike's definition of it. But it's really important that you use sterile water, but not only sterile water, but from a sterile delivery system. So you can't just open up a bottle of sterile water and pour it into your regular dental unit. It's not sterile anymore, right? After you do that. So really important that you have either a surgical handpiece or a monoject syringe with saline, something that's going to deliver the sterile water or saline from a sterile device. And I always get the slides to bring bad news. So I hate to tell you this, but this is a sad story, and it's because of, and this is why we stress to use sterile water from sterile devices, because instances like this. So in New Jersey, I'm not exactly sure. Was this last year, Kellie? I'm not exactly.
It came out last year, yes.
Came out last year, yeah. So a New Jersey oral surgeon, unfortunately, there were 15 patients that got endocarditis from many infection control breaches. But the first thing listed, and I read a lot into this last night, was that he was not using sterile water from a sterile delivery system. So, and unfortunately, out of the 15, one of the people died. So it's a very serious thing. So if you're doing any kind of surgical procedure, and again, it's clearly laid out for you by the CDC, make sure you're using sterile water from a sterile source.
All right, Mike, second pillar, dental unit water. This is what we're talking basically entirely in this webinar about, aside from those last 3 slides.
Yeah.
What does the CDC say for dental unit water lines?
This is the one part that we kind of know about, right? This is non-surgical dental treatment water. It should be as drinkable, and you want to make sure that it is by testing and monitoring it regularly. The CDC's got some guidelines. They say shock or treat for the manufacturer's instructions. Read the instructions for use for every product that you use in your office. They further say a 2-minute flush in the morning and 20 to 30 seconds between patients. And they like dental unit water bottles, but not nearly as much as we like dental unit water bottles. We like dental unit water bottles because if you've got water bottles, you got clean water. You can have clean water in 10 minutes, right? You can. We just know they give you control. But that's regular treatment water. What about verification, Kelly?
Verification. So you want to test regularly, and that's what they say, regularly. They want you to follow your dental unit and your treatment product manufacturer's instructions. And we'll get to frequency here in a little bit. That is quarterly is becoming really the standard, and monthly to quarterly. And we'll dive into that. But verification of your compliance, right? This is the third pillar. That's your documentation. Kellie T has a background in nursing, and right, if you didn't document,
if I didn't document giving someone a Tylenol, right, it didn't happen. And so documentation is key. It's gonna prove that you meet the CDC guidelines and that you're compliant and that you're safe for your patients and for yourself. And yeah, I know from experience, if I didn't document it, it didn't happen. So really, really important that you verify.
Well, so that documentation. Sorry, Mike, go ahead.
No, I just think here's a way to drive that home. When you follow the CDC guidelines, you're protecting your patients and your staff. But when you document it, you're protecting your practice, your reputation, and your business, right?
Oh, yeah. I love that.
There's a good reason.
It's true. There you go.
All right. So that's what the CDC says. Those 3 pillars, very important. Sterile water, sterile delivery system for surgeries, dental unit water. It needs to meet that EPA standard of 500 CFUs or less, colony forming units of heterotrophic bacteria per milliliter or less. And then you want to document. You want verification of compliance of training procedures and of testing. So the proven protocol is what we like to call basically these 3 steps that we've been talking about, right? In the very beginning, we talked about these 3 words. The CDC says you want to be doing chemical treatment, whether that's shocking or treating, you got to meet that 500 CFUs. This protocol is the way that our lab, after hundreds and hundreds and hundreds of thousands of tests, looking at real world clinical test results, we have discovered what practices use that get the best test results, what they do. And that's the 3 steps to safe water, which are?
Yes, 3. We love 3 steps. We have a lot of 3 steps around here, but make it simple because, like I said at the beginning, we want to set you up for success. So step 1 is to shock first. And again, that shocking is using that strong chemical to clean out the insides of your lines. And we're going to dive deep into each one of these. Step 2 is to treat daily. So using that tablet, straw, something that's designed to be continuously present in your water bottles and your water lines all the time. And then test. And then step 3 is to test. And we say test quarterly. That is recommended by OSAP as well as pretty much most everyone now. I think.
As well as basically all the dental unit manufacturers and treatment manufacturers.
Mm-hmm.
So step 1 is shocking. Let's dive into a little bit deep. Give some recommendations, Kelly.
Yeah, so shocking, again, using that strong chemical. So we showed you those pictures of the biofilm, right? How it can be really, really thick and stubborn. And even though you may not see that coming out every day, like we showed you the clean water, when you shock with a strong chemical and then you flush it out, you may see some of that stuff coming out. And we have a lot of pictures or a lot of people calling. I think one of I had to have Mike come in to console a poor gal that thought worms were coming out because it was the shape of the waterline. So yeah, it can happen. So shocking with something strong is important because you can't get in there with a brush to like clean it out, right? We just have to, we rely on that chemical. So we recommend a product made by Crosstex. It's called Liquid Ultra or a diluted bleach solution. Now this is, we told you we weren't expert in evacuation or suction lines, but we do know this, and this is really, really important. So if you haven't been paying attention at all during this is key.
Wake up.
Here. Do not put any waterline shock, so the diluted bleach or the Liquid Ultra, down your evacuation or suction lines. The suction lines has their own shock products. You don't want to put those down. What we recommend down your suction lines, it will damage your amalgam separator. So not experts on amalgam separators or evacuation lines, but we do know that. So that's really important. If you're using a straw treatment, we love the straws. So if you're using Stericyl, Dentapure, BluTube, you still need to shock. There's not a magic bullet out there. Wish there was. I wish there was a kind of a one and done kind of thing, but there's just not. And we have a lab that has allowed us to kind of test, and we know that that's true. So if you're using a straw treatment, that's great. Still need to shock, but never. And again, another important part. So wake up. If you're using a straw treatment, do not shock through the straw. It will ruin it. So you don't want to shock through your Stericyl, Dentapure, or BluTube with the products that we just recommended. But you can remove those and use a dummy straw. And it's just an empty take-up tube or uptake tube. There's no chemical in it. It just lengthens the straw so you can shock your lines. And
yep, you can request one of those at proedgedental.com/dummy. We send those out complimentary. If you're using a straw product, Dentapure, Stericyl, BluTube, BluTube's got one included in it, so that makes it easy. Dentapure, Stericyl, if you or any of the other straw treatments, if you need a dummy straw so that you can shock, you just go to proedgedental.com/dummy and you can request that. Now, if you're wondering, well, I use a straw, but I don't know if I need to shock, we'll get there. The only way to know is to test, but we'll get there.
Yes.
Kelly,
yes.
What about tablets?
Yeah, so we love tablets too. We have BluTab, great product. We love ADEC. There's many other tablets. You still need to shock. Nothing's magic. However, you don't need a dummy straw. So the uptake tube that you're currently using, you can shock right through that. In fact, it'll clean that out too. So if you're using it to tablet, that's great, but you still need to shock. Each tablet comes with instructions for use, and all of them say shocking is absolutely necessary, and it is.
Mike, if you're direct to city water, right? If your dental units are hooked up to the municipal supply and you don't have water bottles, so you're not using a tablet or a straw, what do you do then?
Yeah, if you're just getting started and you don't have water bottles, here we could do a commercial for a product we don't sell. We have water bottle. I'm just saying, we love water bottles, and it really surprised us that you can retrofit if you're on city water and don't have water bottles, we recommend you retrofit, because then you can shock your water lines clean and you can have clean water fast. And to retrofit's about $190 per unit to retrofit and get a water bottle on there. And it's handy, it's easy, you can get a quick release. And then you can shock your water lines and get clean water and pass your water test results. For people who are frustrated and are on city water, $190. Most equipment manufacturers make them for their units. And some companies like DCI make them that are universal for all units. We love them.
So, and to Mike's point, all of the recommendations that we provide is based on our lab test results. So, right, we're the largest dental water lab in the industry, and we see all of the test results. We know what works, we know what doesn't work, and that's what we base our recommendations off of, and that's what we base our product development off of. So, right, we like water bottles, but we don't sell water bottles. You can certainly do that with Henry Schein.
Actually, it's a good point, Kelly. You actually order it from your from the service department. So your Schein service technician will install it. They will order it from the parts department. It's not like it's in the catalog or anything, but your service department can help.
And then also when we just talked about shocking with diluted bleach and Liquid Ultra is made by Crosstex. It's just the best shock product on the market. That's why we recommend it. You're going to get great test results with it. Now, some people out there might have centralized systems. Talk about the positives and negatives there.
Regardless of what you use, in our experience, which is significant, we have learned that these can be part of the problem or part of the solution. So you want to make sure that you test them frequently too. You do have to shock. You have to follow their instructions for use. It might sound great. Might just say, let me just buy something and be done with it. Turns out that you can buy something, but you're not done with this problem. You've got to do routine. You got to do maintenance on it. You got to shock regularly, more regularly than the salesperson or the marketing people might say. And you got to test it regularly to make sure that it's working.
Now, you may have noticed as we went through those tablets, straws, centralized systems, municipal supplies, really doesn't matter your situation. You still need to shock your water lines, right? That's why it's in the 3-step protocol. It's what's going to clean the inside of those lines that you can maintain with treating. And if you want great test results, that's the way to go. So that's step 1, shocking. Step 2 is treatments. Now, part of the reason why we know that regardless of the treatment product that you're using, you need to shock is from data published in a compendium article by John Molinari and Nancy Dewhurst in 2018. And they used the largest treatment efficacy study ever done, over 22,000 consecutive tests of real-world clinical test results, right? These are offices testing their real-world water lines with their treatment products. And what was discovered is that over 31% of treated dental unit water lines, so using a shock or using a tablet or using a straw or a centralized system in some form, overall, the entire industry failed 31% of the time. Now, dove into the categories of products, and we found the most popular do okay. Tablets and straws are the most popular treatment products available, but both of them are passing in the 70s, 77% for tablets, 72% for straws. But one of the important key things from that data is that tablets with a shock passed almost 90% of the time. Now, we like tablets and straws. I don't think that this is necessarily something specific to tablets, but again, it's the 3-step protocol. Mm-hmm. It's utilizing a low-level antimicrobial, your tablet or your straw, with a regular shock treatment. That's going to get you the best results. Kellie T, it all goes into what we call the great battle.
Yes. And I'm having a battle with the sunlight right now, so I apologize if I am going blind.
You're glowing.
Like I can hardly say. It wasn't like that when we first started. Okay. But yeah, in all seriousness, the low-level antimicrobial, if you think about your tablets, your straws, so the Dentapure, Sterisil, BluTube, the ICX, Citrasil, any kind of BluTube, any tablet or low-level antimicrobial that you're using, it's got to be safe enough to put in your patient's mouths, right? So it's designed to be continuously present in your water bottle and your water lines. And it can do okay. It can handle its own against low levels of bacteria. And so this diagram here, what do you call it, Kelly?
The GIF.
GIF. Yes, GIF. This GIF, it's perfect. I thought he found it on the internet. Didn't know that he created it himself. He's so creative. But it shows the guy with the sword and the shield represents a low-level antimicrobial. And you can see how low-level antimicrobials they're fine, but over time, shocking becomes necessary. So you got to pair them both.
Kelly, you're muted.
The simplest way to understand this is, right, just what you dental professionals recommend to us as patients, right? Even if I brush every day, doesn't mean I don't need to go and see you guys for a regular dental appointment, right? Where you're fully cleaning my teeth or giving it a really great cleaning. That's like shocking. And then treating is like the daily brushing. You need both of them. You can't go one or the other. Now that takes us to step 3, which is testing. And testing, like we've talked about, is the only way to verify if your protocol is effective. Mike, talk to us about testing frequency.
Well, in the last couple of years, this is kind of news. Most equipment manufacturers have changed their instructions for use. Dental equipment manufacturers, ADEC, Pelton, Midmark, Dentalese, Forest. Now they all say test your water quarterly or test monthly and then quarterly. They're protecting themselves because the FDA's got some new guidance for them. The OSAP position paper that was published a couple years ago really does a great job of spelling it out. The state of Washington, listen to John Molinari when he said quarterly testing is an interval that we can wrap our heads around, and it makes sense, but it builds a culture of safety. Testing quarterly, people who test quarterly just get the best results. People who test annually or less than quarterly fail because they have to start over every year. Sometimes there's changes in personnel. So we've just learned quarterly testing seems to be, well, there you go. The data proves it.
It's almost as if you knew what slide was coming, Mike. So, right, this is unpublished data from ProEdge Dental Water Labs. We looked at government facilities and community health clinics, which are required to do quarterly testing, and their pass rate. They're at 95%, and the vast majority of them use the 3-step protocol. And then you also we looked at other groups like DSOs and general practices, which generally don't have or aren't aware of the same requirements on their practice in terms of testing, and they pass in that 70 percentile. So quarterly testing, like Mike said, creates that culture of safety. People, right? It helps you develop an effective protocol and keep your eyes on this thing. When we look at not so much frequency of testing, but the just simply amount of testing, first-time testers tend to struggle. So first-time testers from our data pass around 60% of the time. We've looked at smaller subsets of data from, with DSOs and certain other categories of clinics, and they can be as low as 47% as first-time testers. But the more you test, the more you learn how to pass, right? You learn what it takes to be safe, and you understand, is my treatment product working? Am I following the instructions for use? Your staff is now accountable to something, and they want to improve. They want to get better. And if you can get to right around that 95% pass rate, you're doing really great. And your practice and your patients are way more protected. Now, that is a lot of the science. Here's the deal. This can seem maybe a little bit overwhelming. For a lot of practices, they're still just getting started or trying to figure out what is their protocol, how are they going to do this effectively. Well, we just want you to invite you to partner with ProEdge. That's what we're really in this for. We believe that when we come together with your dedication to patient safety and you leverage our expertise and we just support you, we can be safer together. So we've got a few offerings for you here at the end, things to educate you on in terms of solutions that we've developed to make you more effective in your water lines. Because again, we see all of that real world clinical test results. And when we develop products, Mike, we want to develop them in a way that's going to make practices more efficient and effective in their treatment and testing of water lines.
Tablets made everybody's life easier, and then straws made everybody's life even easier. We've been wanting a straw for a long time. And what we learned by testing so many, 1/3 water samples, is that most of those straws, those Stericyl and Denapure straws, are just bulletproof for 6 months or so. And then the failure rate starts to go up a little bit because they run a little low on that low-level antimicrobial. That's what Kellie Thimmes been saying the whole time too, right? Turns out that 6 months is the sweet spot for a straw if you want to pass your water test results. BluTube comes with 2 6-month straws for the price of a 1-year straw. It comes with this cool low-tech indicator that turns red at 6 months because I need all the help I can get in remembering stuff like that. And that's it. It's available from Schein. I think they got a smoking deal on it too.
That's right. Well, Adam, if you want to put the link in the chat again, you can take advantage of promotions on all these products. But BluTab's another winner, right, Mike?
It is. It's been very popular, and of course, people still love it. And yeah, the reason it gets such a good pass rate, maybe because it's just got instructions, maybe just because these guys read their instructions for use. It's also because the instructions are kind of easy to follow. It says shock every 2 months and test regularly. And gee, if you do that, yeah, 90%, it's 5 times better than everybody else. So good for you. So, and also, yeah, I think it's Adam can give you a link to this one too. I think it's buy 3, get 1 free. It's County Award winner.
Now testing, Kelly, what are the options for testing?
Yes, we have the gold standard, which is the RTA test method. You send it into our lab. You would purchase it from Schein. You send it into our lab. It comes with everything that you need to get it to us. You overnight it to us, and then you'll have your results in 7 days. But we also have a new, amazing, can't say enough good about it, testing method called Flow. And you purchase the kit through Schein for around the same price as the R2A, except best thing about this is you get the results the same day that we receive them. So you can either celebrate early or take corrective action right away. But Flow is just awesome. We love it. And then we have Quick Pass, right, Mike?
Right. You can do it yourself. Quick Pass. You just take the sample yourself, let it sit for a minute, membrane side down, dump the water out, and then let it sit at room temperature for 2 to 3 days, and it grows red on white. It's designed for dentistry. It's the only one that's designed for dentistry. So it neutralizes that low-level antimicrobial. No matter what you use, we verified that it will neutralize the Denapure, the Stericyl, the BluTab, the Citrusol, whatever you're using, so that when you read it 3 days later, you know if you passed or failed. If it's red, it's time to shock. Don't freak out. Just it's time to shock. Right?
See there, Mike is showing how deep we get into Waterlines because he's talking about germicidal neutralization. And
okay, sorry, that was a nerdy thing to say.
It's
important thing. It's important.
Long and short of it is it makes it more reliable. It's recommended by OSAP for all Waterline tests. All our lab tests do that. And Quick Pass is the only in-office test available that does that as well. But we've got a tip for all of your testing, whether you're using lab testing or Quick Pass, that's going to save all of these practices about 75%, Mike.
Oh, yeah. You don't have to buy one of these for every single line in your office. Just buy one for every operatory and do a combined sample. So take equal amounts of water from all, let's say in Op 1, you got 2 air water syringes and 2 high-speed handpiece lines. As long as the amounts are equal, you do 25% of each, fill it up. If you pass, we've learned that means all 4 of those lines are safe. Shannon Mills said so in the OSAP position paper. ADEC likes combined samples, pooled samples. The state of Washington, pooled samples. You can save 75%.
You can watch a video with Kellie T on how to do that at proedgedental.com/pooled. A couple more resources for you to make your life easier and better and simpler. ProEdge just launched our online dashboard. So all of the laboratory testing, the R2A and the Flow, those test results are delivered to you digitally online. So you have cloud storage, 24/7 access, and complete visibility of what's happening in your water lines. That's all.
How much does that cost?
It's free.
Free?
Pretty cool.
We like free. Couple more resources. ProEdge YouTube channel. Go to proedgedental.com/YouTube. You'll see lots of weird, fun little videos from Kellie T and myself helping you with the 3 steps to safe water, or how to use Quick Pass, or how to use BluTube, or pooled samples. We got a bunch of videos for you. They're short, quick, and a little bit fun. So we always like to say dental unit water lines don't have to be boring. We're proud of our nerdiness. We know you guys don't necessarily love it all the time, but we're proud of it. But Kellie T, one of the most powerful resources we have is consultation.
Yes, it is. And I think this is my favorite part about ProEdge, and really I think what sets us apart from any other lab is we truly, truly want to help you. You can reach out to our team, to our customer delight team anytime. doesn't matter if you're using our products or not. We want to help you with whatever product you're using. We want to set you up for success. Like I said at the beginning, we have researched every single product out there. And so we want to just help you get the best results possible. I'm in sales, so I'm not going to try to sell you anything. Now, these two don't, no, but I honestly, I don't see one more Mimi Morales or another dentist that calls that has, mycobacterium. And that's honestly, my passion is just to spread this news and to help you. So please reach out to us. We'd love to talk to you. Even if you don't test with us or use our products, we offer free consultations to anyone, anytime.
Now, Kellie T, bring us home quickly too, because we're running out of time.
You're running out of time.
And there's some good Q&A questions. There's some good questions we want to ask.
Sure. Yeah. We talked about a lot, and so we will get through this and get to your questions. But man, we talked about the why, right? We talked about the tragic story of Mimi Morales. We talked about how quickly bacteria grows in waterlines and why it grows so quickly and how it spreads down line. We use the dandelion analogy. We went over the 3 steps to safe water, how to shock, to treat, to test, and how if you do all of those, you can prove that you meet CDC compliance and that your water is safe, and so much other stuff. So like I asked at the beginning, and just to kind of close with this, and then we'll get to your questions, can you honestly answer with sincerity this question? Is your water safe? And like I said, if you can say, yes, we test quarterly, we get passing results all the time with whatever you're using, right on, keep doing what you're doing. If not, please call us. We want to help. We have answers to any questions. And if we don't, we will find them for you.
All right. So let's move into some Q&A. We've got some really good questions so far. First comes from Leslie Grant. It's actually not a question. It's in the chat. So if you've got questions, pop them into the Q&A quick, and we'll try and get as many as we can. But Mike, Leslie asked, please mention ultrasonic scalar lines, which we know some unique data and how.
Yes. You're making fun of me because I've made every mistake. Ultrasonic scalars are hard to shock, Leslie. They're harder to shock because the water moves slower. It's harder, the lines are longer. Sometimes they're 25 feet long instead of just 6 feet long, right? Because it's a quick connect to the unit, then it goes to, and here's another one. I've done this one wrong too. Sometimes you got water bottles on your units, but the scalar, the Cavitron's not connected to the water bottle. It's still on city water. You can't shock it if you wanted to. So you got to retrofit that one. Yes, shock your scalars. Be sure to shock them and test them. They're the hardest. The Molinari article proved that scalars fail 50% more often. Why? They're harder to shock. The lines are longer. There's more stagnation. Great question, Leslie.
That's right. All right. Geraldine Smith says, we test water for iodine. What does Quick Pass test for, Kellie T?
So Quick Pass is going to test for bacteria. So it's just like doing sending in your test for us. So the iodine test strip that you do, probably using it with your denture, that's just specifically testing for the iodine level. And that's going to tell you if you still have enough iodine that's safe for patient use. Keep the Quick Pass and all of our testing, they do a heterotrophic plate count. We're testing for heterotrophic bacteria.
Yep. So Quick Pass lab tests, the flow, the R2A, they're all testing for CFU counts to make sure that you're CDC compliant. Real quick, Geraldine, with that iodine, if you're testing for iodine, that probably means you're testing so that because you use a lot of water. Again, BluTube is a straw product that has almost double the amount of iodine in it over the course of 1 year. So like Mike talked about, the traditional straws right around 6 month mark drop below 1 part per million. You don't have to worry about that with BluTube. It doesn't approach that line. So just quick plug, right? Kellie T said she's not a sales guy.
Right, exactly. Yeah. Kellie T will never sell you anything. But Kellie B and I don't mind if you want to buy something.
Yeah, we don't. We just want to have to bring up the promotion slide one more time. But Geraldine, great question.
And keep doing that. You want to make sure that's above 0.5. Make sure.
The testing that all the testing that we're talking about is about CFUs. which is about the compliance with the EPA standard and the CDC standard. All right, Mike, how often do you recommend shocking?
Yeah, and there was another one in there that said, we shock every week. Is that overkill? So this, I try to answer both those questions quickly. I'd say, if you don't use a tablet or a straw, all those shock products are weekly shock products. That Birschbach study that Kelly mentioned shows that the bugs come back in about a week, 96 hours, 4 days later, they start to attach. So if you only shock, you got to shock every week. If you use a tablet or a straw, that low-level antimicrobial buys you months, but not years. You still need to shock. So with the tablets, all the tablets pretty much say shock every 2 months. 8X ICX product says test and see if you can go shock, to see how long you can go without shock. But all the other one, well, BluTube, the Schein, Patterson, the Z3 product from Benco, they all basically say shock every 2 months. Test regularly.
So, and one of the things you can do, you can always use testing to see if you can go longer in your shocks, right? If you're shocking weekly, or if you're shocking monthly, quarterly, semi-annually, annually, if you're getting great test results, you don't need to switch to shock frequency. But if you are getting good test results, it is a key performance indicator of, hey, we need to either shock more often, or we need to follow our protocol better, or we need to switch up our protocol. So you can use testing to determine if you want to go longer.
Good point, Kelly. And we have people who are using BluTube and they're testing quarterly, but they're going 6 months without shocking. They shock. If the instructions just say shock on the install, go 6 months, and they're getting great results.
Always selling. Kelly T. Geraldine has another great question. Is it best to use distilled water or tap water? And if we use one or the other, do we still need to test and treat?
So we like tap water, as long as it's a good potable quality water, tap water. If you want to use bottled water, that's going to be probably your best bet. But tap water is fine to use. We actually recommend it. Now, like I said, if you're in an area with super hard water, we recommend maybe doing like a bottled spring water or artesian water. Distilled water can be a little bit harsh on your equipment. But yes, you absolutely still need to treat and test.
So going back to that Birschbach study, right? Over 200,000 colony forming units in less than 5 days with sterile water. So tap water just needs to meet the 500 CFU standard. Sometimes it doesn't even meet that. So tap water or distilled water, you still need to treat, you still need to test. And we're running out of time here. One of the things I did want to highlight again with this, aside from the order offers or the purchase offers, anybody that registered for this webinar, or anybody that's on this, can click the link that Adam put in the chat, and you can actually request a Henry Schein FSC, field sales consultant, to come out to your office, and they will actually perform a quick pass water test for you. So if you're not sure, you never tested before, feeling, with Kelly's question, is your water safe? If you're somewhere in the middle there and you're wanting to try out a test before you move forward, go ahead and click that link in the chat, request the complimentary quick pass test, and they'll come to your office and help you out. Looks like we're right at 6 p.m. Again, feel free to reach out to ProEdge and do a consultation with Kellie T. She'll help you use your protocol and your products effectively. I know we had some more questions in the Q&A that we didn't get to. So all of those questions we've got answers to. Kellie T can help you. You can go again, proedgedental.com/consultations. But I'm now over time, I think. So Adam, any parting words for us?
Of course, got to kick you off right at time. Like Kelly said, if you want that complimentary waterline test, the link is in the chat for you. Definitely take advantage of it. But no, all seriousness, thank you, Kelly, and Mike, for your time today. Great presentation. And of course, thanks to the ProEdge Dental Water Labs for sponsoring this webinar. Like you said, if anyone has additional questions about anything or Waterlines, please feel free to email us at webinars@henryschein.com, and we will definitely put you in touch with the right people. Additionally, if anyone is interested in attending future Henry Schein webinars, visit henryscheindental.com/webinars for our upcoming schedule. The link of today's recording will be sent out within 1 week of today, so keep your eye out for that. Thank you all for attending and have a great night, everyone.
Thanks, guys.
Thanks, everybody.
We'll see ya.
Thanks, Adam.